Oh, I had someone else last time.
Hello, you're Chantal.
Yes.
Yes, hi. I'm June, I'm one of the midwives. You met Bernie, I think, last week,
Yes.
didn't you? Yes. And this is Ellie, who's a student midwife. Okay. So you came last week and you did most of the booking, but you weren't quite sure about how things were going. So you've come back today and are you a bit more resolved in your mind what you want to do? So you're going to continue with the pregnancy then?
Yeah.
Okay. So I think we got to the point where we wanted to talk about the blood tests that we offer you in pregnancy.
Okay.
Yeah. Did Bernie give you any information last week? Have you had a chance to have a look at that?
Just kind of skimmed over it.
Okay. So do you want me to explain the tests that we offer you?
Okay.
All right. So we like to take several blood samples at the beginning of pregnancy, and they're to find out what your blood group is. Do you know what your blood group is? Have you ever given blood? No. So that'll either be rhesus negative or positive, and we'll check for antibodies in your blood, and then we'll also screen for sexually transmitted infections. So that includes syphilis, hepatitis and HIV. Are you all right with those? Yeah. And we'll also check for rubella antibodies to make sure that you've got protection against germ and measles. Sickle cell and thalassemia are the other blood tests that we offer you, and they're to check because we don't know which women might be a carrier for those. So we actually want to check and see if you are a carrier.
Okay.
You look like I'm going to eat you.
I really do not like blood.
No, and most women don't like to have blood tests done, but it's a really important part of the screening process, and we don't take them unnecessarily, we only take them, with good reason. So do you think you'd be happy with having the test done today?
Yeah.
Yeah. Did you expect to have some blood tests done today?
I wasn't expecting it, no.
Okay. I mean, we have got a little bit of time. You could go away and think about it, but sometimes that's worse than actually sort of just getting on and having it done. Yeah? Okay. So in addition to the blood tests that we would take today, which I've already talked about, there's another test that we offer you, which is to screen for Down syndrome. Do you understand what I mean by Down syndrome? Yeah. And that can be done with your first scan, providing that you're under 14 weeks when you have that done. Mm-hmm. And they take a measurement from the back of the baby's neck, and they'll also take a blood test from you, and they'll also weigh you at the same time. I know you probably were weighed last week, and your BMI is a little bit on the low side, but that's fine. But that's part of the tests that they offer you. How do you feel about that? Have you got any thoughts about whether you would want that testing done?
It's a lot of tests.
It is. It's a lot to take in, but that's not something that you need to absolutely decide today. I do need to say yes or no to whether you would think about having it done, and it's better to say yes at this stage because then they'll arrange your scan with enough time for them to do those tests. If you change your mind when you get to the hospital to have that scan done, you just tell them at reception that you don't want it, and they'll just do a normal dating scan for you. Okay. What you do need to think about though is the consequences of having the test done, because if you go ahead and have it taken, the results come back as either a low risk or a high risk. If it's low risk, then it doesn't mean no risk. It just means that it's less than 1 in 100, more than 1 in 150. If it comes back as a high risk, then they will offer you further counselling. They'll offer you to come into the hospital and talk about the tests that they can then do to actually directly check whether the baby has got the Down syndrome chromosome. That's called an amniocentesis. And that's where often you'll hear women say that they had a needle in the belly, or that they've heard about the needle in the belly. Is that something that you're aware of at all? Okay. In the booklet that Bernie gave you last week, There's a whole chapter about this Down syndrome, so I would advise you to go away and read that, and maybe talk to somebody that you're close to about it as well, to get their opinion. But ultimately it's your decision. If the risk came back high, and if you decided to have these tests done, ultimately they would offer you a late termination. Now that again is entirely your choice, and some women want to know the results but choose to continue with the pregnancy, and that's fine. And other women decide that they actually want to finish the pregnancy early. But it would be done before you were 24 weeks if that happened.
Okay.
Okay, so that's something else that you really need to consider quite seriously. If the results came back high, what would you do? Okay. I know that's a lot to take in today, but it's really important that you do kind of think about that a little bit more. So we'll take some blood tests from you today. Okay. And not for the Downs, this is just for the other tests that I talked about.
Okay.
Okay.